Okay. I, Hello, everybody, and welcome to the this broadcast. Oh, here we are.
Here we are.
And now let me add you. Or I'm just double checking.
Yeah. Over here in the States, we have Zoom, not StreamYard.
Yeah, actually, when I've tried that before, other things have gone wrong on me. So I just want to see this as live. Just bear with me a second as I work out the technical little glitches here, just to make sure that okay. Now I need to get you on the screen. There you are. Okay. Now, welcome. So Seth Deborah, we are here now, and we are talking about the workshop and on on Medical Hypnosis 101.
Medical Hypnosis 101, a very quick one-day workshop. Yeah.
A very quick one-day workshop.
That's why we call it 101.
Absolutely. Absolutely. And so I've got some questions that have lined up that have come into me already. So, but do you want to just basically give people an outline of what's coming up in that workshop? If just a little bit about you. I mean, how come you're able to do this?
Well, normally I give a 2-day workshop certification in medical hypnosis, although a lot of people have told me I need to make it a 3-day workshop. But anyway, it starts off a little dry with physiology, anatomy, how hormones work, neurotransmitters, the nervous system, the parasympathetic, the sympathetic, the enteric nervous system, because you kind of need to know. You don't need to like take a test on it, which a lot of people get a little nervous about. Oh, I'm going to learn all this medical stuff. No, you just need to have a little background, and that allows you to understand why you're doing it.
Yep.
And also to talk the language of the medical community, right?
Gotcha.
And that way, even if you're not, quote unquote, a medical person, you'll have the rapport with, the doctors and nurses. It's just like when they have the reps coming in to sell them medical equipment. They're not physicians. They're just people who've graduated college and took some training in Medtronic per se. But because they speak the lingo and they understand what's going on and why you're doing such and such, they're accepted. So it'll be the same thing for people when they learn the lingo, understand the concepts and why this works, so that they can, number one, present it to the physicians or medical people, but also to the patient or their client, and also to figure out more flexibility. If things don't work, okay, well, how can I hit it from a different avenue?
Gotcha.
So that's part of the essential part of that medical hypnosis training. And then for the 1-day workshop, I'm going to, of course, talk about that and squeeze in as many everyday things that people can use, like for cancer, for IBS, for surgery. Of course, you could go into the little intricacies of it for the 2-day program, or like when I do my 1-day IBS. But this is to give you a good introduction at a deeper level than just an introduction, as deep as I can go in that time frame.
Gotcha. So the question is, how does understanding medical issues help our practice?
Well, first of all, it helps to make more money.
Okay.
Quite simply, it's a niche that is almost never ending, in that when you do a good job, you keep on getting, never mind from the patient or client referrals, but from the medical people who sent it to you initially. The important thing is to keep in touch with them during you're working with the client, and also when you've had success, to get back to the office that sent you the client so that they can refer. It's like GI guys, they're getting IBS patients all the time, right? The orthopedic guys are getting surgeries. They're doing total knees, like 5 a day, right? So to get that referral system going is really important, and it's more money in your pocket. Plus, you are really helping people where they're at their wits' end, right?
Yeah.
If you're talking about just weight loss before the surgery, they will do better during the orthopedic surgery if they could take off 5-10 pounds, right?
Okay.
So, yeah.
What would the medical conditions that you would cover that would a hypnotherapist could actually cover? Is it pre-surgical hypnosis for anxiety, post-recovery for stronger immune system, IBS you've mentioned? I'm only literally talking off the top of my head right now, but
those are the main ones. I myself had a diagnosis of fibromyalgia after my mother died.
right.
All kinds of fighting with my brother, blah 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 blah. They put me on sleeping meds, and no, they didn't. They put me on Zoloft, and then I went and I figured, something's going on emotionally, and I worked with somebody else, and I let go of a lot of the anger that was going on within me. Got like 2 good weeks of sleep, and I woke up one day, my fibro was gone, absolutely gone. So definitely on those autoimmune disorders where we're kind of fighting against ourselves to find out where that's coming from and release it.
Okay.
And also sleep is very, very essential, because that's when our body heals. It's when our body renews. So people getting good sleep is very, very essential. I was listening to this fellow on Laura Trump was interviewing him. He's a quote unquote, his first name was Greg something. He was a biohacker, right?
Yes.
How to live longer. I mean, he has an oxygen decompression unit in his home.
Wow.
So he's really into how to live longer. But he said the one thing is better sleep.
Yeah.
It is essential. So, again, autoimmune diseases.
Yeah.
IBS, irritable bowel syndrome. Crohn's is in there with that. Crohn's has, I would say, a lot more emotional issues than IBS that you would deal with in addition to the typical IBS program.
Okay.
Definitely pre-surgery anxiety.
Yeah.
Okay, because how you enter the anesthesia experience is how you wake up.
Gotcha.
Right. Okay. And so to make you feel better before you have surgery, be less anxious so that your blood pressure is not 200 over 110 before they're going to, give you anesthesia, is essential. And to teach people their own skills too.
Okay. What do you mean by their own skills?
Say again?
What do you mean by their own skills?
Well, their own tools to put themselves into trance.
Okay. Oh, sorry. Self-hypnosis. Yeah. Yeah.
So when they're starting the IV, to get their arm numb, or to imagine, you're in a bathtub and the vessels are coming up to the surface.
Yes.
And guess what happens? Your vessels really come up to the surface, and they make it a hard stick, an easy stick, right?
Perfect.
Because like here, you can see my veins are all the way up to the surface. So, but even though my veins are up to the surface, when I went for my surgery about a year ago, something like that, I was nervous because our surgery, they had me scheduled for, I think it was 3.5 hours. And I went, uh-oh, holy shit, what's going on? And my veins went like that. And I became a difficult stick. Which
gotcha. I understand.
Right? So, you never know when those nerves are going to get to you. So you have to teach people skills. Also, what I like to do is work with them about 2 weeks before.
Okay.
If since COVID, and my husband's death, I've let my office go. So I go to people's homes as long as they are referred to me and I'm feeling safe, or I'll go to the hospital, things like that. Anyway, what I'll do is I will have them, well, I also do Zoom, but whether they're on Zoom or in person, I have them in trance, get up and feel the back of the chair and go deeper in response, do it over and over again, so that when they're in the pre-op area and they're sitting in the reclining chair and they feel their shoulders, they touch it, and they can just, again,
So
a physical anchor.
Right, you're creating that physical anchor, absolutely.
The other area, let me know if I'm talking too much.
No, you're okay.
Passion of mine. The other area is cancer.
Okay, and I was going to ask you specifically, just before you get on to cancer, there was pre-surgical anxiety, Crohn's, IBS, autoimmune.
Yeah.
What about post-recovery times? Or there seems to be some evidence to support that. Is that something that you're going to cover, as in post-recovery hypnosis?
Well, there's really, the only thing that is proven, and it's not 100% proven, is that as far as surgery goes, that your wounds heal faster and your recovery time is shorter.
That's a pretty significant statement, though.
Yeah, but it's not proven. They just say, well, this kind of happens.
Yeah.
What is proven is one time at, I think it was Mount Sinai in New York, one of the hospitals in Manhattan, they did pre-op hypnosis for breast cancer patients, biopsies, and they left the OR sooner. They got discharged from the recovery room sooner, and each case saved the hospital $770.
Yeah.
Because they needed less staffing, less medication, blah, 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 blah. So, I mean, they know this. There's studies out there, even that prayer. I think UC San Francisco did a study about prayer, where they had people who were prayed over and not prayed over. And even if you didn't know that you were being prayed over, you did better with prayer. So
absolutely. Yeah.
Yeah.
And I mean, I know Gary Coles will be at the conference, and Gary is covering psychoimmunology, which of course is that power of the mind and the body to heal and connect.
Yeah.
And there is other evidence out there to support that on top of that.
If you know anyone who's gone through a cancer diagnosis, it's a lot.
Yeah,
it's a lot. My girlfriend, who is my girlfriend now, who I first saw as a stop smoking client, is a cancer survivor. So she came to me years ago to stop smoking. And then she looked me up again, and I had closed my office. And she literally went knocking on my door here to find me. She had a needle phobia.
Right.
She was going to have cancer surgery. So working with her with that, and then I actually accompanied her in the pre-op area. And I've been working with her now, well, we're friends, but like for 5 years, even during, she was doing clinical trials where she would fly down to LA and they would draw like 16 tubes of blood.
Wow.
And the financial strain and the family strain. And of course, the nausea, the losing your appetite, the back pain now. I mean, all the cancer journey is such a hard thing to go through.
And you're going to teach how to support people through that.
Yeah.
Okay, perfect. So I mean, that you can see then how that expands people's practices, and ultimately that's the point of this conversation, is to allow people to be able to see that the workshop that the topics you're going to cover will help to expand their own business, because you're now able to
they'll be able to really say, I can help in this way, 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 right?
And that's key, because confidence is so important when you're behind all that. And then what about engaging with medics in relation to that? So doctors, nurses,
Say again?
What about engaging with medics on that process? So doctors and people who would refer, will you cover just what to do in those cases?
You mean as far as getting referrals?
Well, yeah, because I mean, I don't think here we'll be in the hospitals, but maybe I'm open to correction on that. But in terms of working with people through that cancer journey, getting the referrals from the doctor, maybe.
Oh yeah. And now, I mean, you can, in my manual, I have a letter that, to different doctors and dentists, blah, blah, blah. But you can, now with AI, you can make your own letter too, but it's about making that contact, not so much with the doctor, but I don't know how it is in England and Ireland, but the nurse practitioners, the staff of the doctor's office. I mean, medical reps know this very, very well. They go and they bring lunch or breakfast for the front office girls, and they talk to them and they leave brochures. I suggest making a pre-gummed pad that would have your name on it and your contact information, your email, blah, 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 in addition to brochures, so that they could keep the gum pad in the office, in the exam room. And how, like, if you're an orthopedic, they'll say, oh, well, go to this physical therapist, and they just peel it off and give it to you, a referral form. So you can go ahead and you can get a whole lot of them, and there you go. Usually a lot of people do ask me about insurance. Usually it is not covered by insurance. But I tell patients and I tell the doctors and the nurses, we're talking, let's say if you're dealing with pain management, you're talking 5 or 6 sessions and you're done. IBS, you're talking 7 sessions. I do the Chapel Hill protocol. So it's a 7-session protocol. And if I have ulcerative colitis, you add 1 or 2 sessions on top of that. But usually you're done.
Okay. You're covering a huge amount in this then, because you've gone from autoimmune all the way down to pain management now, with a whole lot of places in between, IBS. Pre-surgical hypnosis, Crohn's, cancer, post-surgical in terms of the recovery and the speed and all that. Is there anything?
I mean, physical therapy is hard. I mean, when I had my total knee, working through, never mind the pain, okay, but working through what I call the hiccups when you backslide. Keep on going, the motivation to keep on going.
It's huge.
It's important because it changes you, right?
No, absolutely. And I'm really glad we're having this conversation, because a lot of people will have seen stuff and they go, well, how does it help me? And I mean, that's what these questions are about, actually. And there's at least 8 or 9 things I'm after writing down here as I'm talking to you, that it's actually helping in all of these individual stuff, which, whether you're helping, even family and friends through it, not to mind say, there's not a family in the world, I don't think, that's definitely in Ireland, that hasn't been touched by cancer at some point in time. So is there anything that medically you would stay away from?
Yes, I would stay away from anyone who's schizophrenic.
Right.
I would stay away from anyone who is on psychiatric meds unless the psychiatrist was involved and you were only dealing with stress management. Yes, depression, but again, if they are on psychiatric meds,
anything on psychiatric,
you don't want to play around. Someone tells you I have suicidal thoughts, again, even if they're not seeing a physician, they tell you that, stay clear. Stay.
Okay.
I
Is
mean,
there any medical conditions you wouldn't go near? You're thinking of one now, so that means you don't have one. So that means you pretty much are covering most things that have a
Yeah,
medical.
I mean, you know, in dealing with medical and the unknown, I would say, well, ask your client or Google whatever they're coming in for. What is their goal? Okay, so if
Yeah.
let's say they want to raise their platelet count, okay, then that's what you would deal with in raising the platelet count. So I
Gotcha.
really don't think there's anything that you can't deal with. The one thing I would say is don't say I can cure you.
Of course. No, we
Okay.
can't say that.
I
No, we're not
really
gonna
get
say-
upset when people say I can help you heal yourself, activate your own healing mechanism. I know for myself that I had fallen playing leapfrog when my daughter was in middle school, and I had ripped both lateral and medial meniscus in my left leg, plus the ACL had torn. And because it was football season, I was seeing Dr. Dillingham. He was the 49ers doctor at the time.
Yeah.
And so we had an MRI, could see what was wrong, but I had to wait 6 weeks for a donor ligament because it was football season and there weren't any. Anyway, during those 6 weeks, I worked with another practitioner and we did physical hands-on healing. And this was really hard for me because I was a beginning hypnotist. Seeing it as already healed. That was the hard part for me, that it was already healed. And I said, Oka, it's not healed. Still do it. Still do it. Oka Hothius, she's passed on, but she was fantastic. And anyway, 6 weeks later, went in and the two meniscus had healed.
Mm-hmm.
Not supposed to be able to happen. There's no blood supply. And Dr. Dillingham came out and he just shrugged his shoulders and he said, nothing to do. So I know from my own experience, our bodies are capable of a lot. We don't know what they are yet. Just don't promise that I'm going to heal you.
No, absolutely. And we know even in, when drugs are being produced, they're produced, the tests that are done are against placebo, and placebo is effective in 30% of cases.
Actually, 70%. Actually, 70%.
Yeah, there's all kinds of different stats flown around, but the one thing you do know for sure is that it is above 25%. That's the one thing I know for
real.
sure.
It is very real.
Absolutely. And it's tapping into that. Now, often people are afraid to do it because they don't understand. So in this workshop, you're going to teach them the lingo, you're going to teach them the steps and the things that they can cover then.
Mm-hmm.
Perfect.
Yeah.
So if anyone does want to increase their business and wants to be familiar with medical, then this is the workshop that can allow you to give you that sense of authority and confidence.
Not only increase your business, but have a constant flow.
There you go.
That's right. Because as entrepreneurs, our business goes up, down, up, down. And so hey, okay, I'm getting maybe not just one area. Okay. You could have just do medical hypnosis. You could have IBS and get those docs. You could have pre-surgery and get the orthopedic doctors involved, right?
Yeah.
And go to the pulmonology people and get your smokers. Go to the GPs, have the people that need to lose weight now. And even with Ozempic, they are now finding out people getting blind from Ozempic. Blind, irreversible. And so that's another program I'm going to be working on. So
that's a lot to cover. So if anyone is looking to add medical to their business to, as you said, not only expand it, but have a consistent flow of it.
Yeah.
And this sounds like a workshop that people should be at.
I hope they come.
and it is on the 4th of April. And yes, we do want people to indicate if they have any questions, or if they would like any questions answered. Please reach out to either Seth or myself, and I'll post all the links in the descriptions. But the other side of it is just to let us know if you're interested. Let us know, because obviously there's an issue. There's time involved for you in preparation. There's time involved for you for planning. And if there's enough people, this will go ahead. If there's not, it won't. And it's pretty much that simple, isn't it?
Yeah, that simple. Yeah.
And I know that these workshops are new to Ireland in terms of this is the first time we've done them with the conference. So, it is just it is something that we will become more familiar with over time. But
yeah, and I'm looking really forward to meeting everybody too. Really,
well, it's going to be wonderful. I mean, it really is. There's 9 different countries speaking at the conference. I mean, it's something that's after blossoming and blooming, and I'm kind of blown away by the whole thing, but I'm really happy.
Okay.
So I'm so looking forward. There's only 5 weeks left to go, and I'm so looking forward to seeing everybody there. In fact, in this time, 5 weeks, the conference itself will actually be over.
I know.
Yeah, we're working on it for the last 6 months, and here we go. We're only a month away. So listen, thank you, Seth, and I look forward to seeing you in Dublin before the 4th of April, because and to anyone who's interested, please either reach out to Seth or myself. I'll put all of the email addresses in the links below. And I wish you all a wonderful day, and thank you for those who've logged on, and thank you for those who sent in their questions in advance. So I really appreciate that. Okay, thank you, everybody. Have a wonderful, wonderful rest of your evening. Bye.
Take care.